Welcome to Circulatory Secrets. You go to channel for everything related to cardiovascular perfusion. Today we are diving into an exciting topic, that is cardiovascular perfusion. Whether you are a student, a professional, or just curious about the magic that happens behind the scene in cardiac surgery, this video is for you. Let's get started. Cardiovascular perfusion is the process of temporarily supporting or replacing the function of the heart and lungs during critical medical procedures. Imagine a scenario where the heart needs to be stopped for surgery. How does the body survive without circulation? That's where perfusion comes in. Using advanced machines, we ensure oxygen-rich blood continues to flow to the brain and vital organs. Perfusion allows surgeons to perform life-saving operations like bypass surgeries, valve replacement, and even heart transplant procedures that would not be possible without this technology. Perfusionists are the unsung heroes of cardiac surgery. They operate heart-lung machine, also called cardiopulmonary bypass machine, which takes over the work of the heart and lung during surgery. Their responsibilities include setting up the heart-lung machine before surgery, monitoring blood flow, oxygen level, and other vital parameters, troubleshooting issue in real time to ensure the patient's safety. Perfusionists work closely with the surgeon, forming a critical part of the surgical team. Without them, modern cardiac surgery would simply not be possible. Perfusionists are the specialized healthcare professional who operate the heart-lung machine during surgeries. They manage blood flow, oxygenation, and vital parameters. The transparent center device appears to be the oxygenator, which is essential for replacing the lung function during cardiopulmonary bypass. It oxygenates the blood and removes carbon dioxide. The connected tubing facilitates the flow of blood to and from the oxygenator. Red-tipped connector likely indicates the path of oxygenated blood, while blue-tipped connector indicate return of the venous blood. The cylindrical structure in the lower section of the oxygenator could contain filters to prevent air bubbles or debris from entering circulation. The entire apparatus is mounted on the heart-lung machine, allowing flexibility in the position within the operating room. In this scene, we see a surgeon performing a life-saving cardiac procedure, but behind the scene, another hero is at work, the perfusionist. The perfusionist operates the heart-lung machine. The surgical team focuses on repairing or replacing damaged heart structures like valves or arteries. The journey of cardiovascular perfusion began in 1953 when Dr. John Gibbon successfully used the first heart-lung machine during surgery. This groundbreaking achievement paved the way for modern cardiac surgery. Over the decades, perfusion technology has evolved from the basic mechanical devices to highly advanced systems capable of precise control and monitoring. Perfusion technology bridges the gap between surgical precision and patient safety by maintaining circulation and oxygenation. It allows surgeons to focus on repairing the heart without worrying about the patient's critical functions. This technology has revolutionized cardiac care by enabling complex procedures with minimal risk, reducing patients' recovery time, improving survival rates in critical cases. Let's take a quick look at the component used in cardiovascular perfusion. The heart-lung machine is the star of the show, and it's composed of several key components. Oxygenator acts as an artificial lung, adding oxygen to the blood and removing carbon dioxide. Pump replaces the heart by circulating blood through the body. Tubing circuit connects the machine to the patient's circulatory system. These components work together seamlessly to ensure the patient's body receives the oxygen and the nutrients it needs during cardiac surgery. Cardiovascular perfusion plays a vital role in several medical procedures, including coronary artery bypass grafting, restoring blood flow to the heart, valve repair and replacement, fixing or replacing malfunctioning heart valves, extracorporeal membrane oxygenation, supporting critical ill patients in ICU setting. These applications demonstrate how perfusion technology is essential in saving lives every day. And that's a wrap on our introduction to cardiovascular perfusion. We have covered what perfusion is, why it's essential, and the incredible technology behind it.